I tend to call it the what ifs. So it's, what if this happens? What if that happens? You tend to catastrophize a lot of things and bring it to the worst place.
Anxiety is a natural emotion and a natural response that we have that allows us to respond appropriately to danger and fear. When anxiety becomes a disorder is when it gets in the way of you functioning.
There are a host of anxiety disorders. Simple phobias are actually one of the most common of anxiety disorders, and that is a fear that is irrational of a very particular thing. Common ones would be thunderstorms, heights, fear of flying. Generalized anxiety disorder is this constant worry about varied topics or one topic and then another topic through much of your day for weeks on end. Social anxiety disorder is like generalized anxiety disorder, but your worries and concerns and judgments about yourself are exclusively in social situations. Panic disorder are circumscribed events that occur, a panic attack, where you feel overcome by a sense of dread, thoughts of perhaps I'm going to die or I'm going crazy. You have physiological symptoms, meaning you have shortness of breath, you feel palpitations, you might feel nauseous, sweaty.
My anxiety will hijack certain things. So I have to reel myself in and really ask myself, am I reacting because this is my truth, or am I reacting because my anxiety is stepping in?
Risk factors for anxiety disorder are a family history of anxiety disorder or other mental health conditions, having a very stressful life. The more stress factors that you have, having experienced trauma or loss early on in an age.
So it's a clinical diagnosis, which means that you need to go in for an evaluation. They will ask you, how much do you worry? What do you worry about? How many hours of your day would you say this takes up?
Most anxiety disorders are treated either with medications or with cognitive behavior therapy, because anxiety disorders are really a thought disorder. So we're going to work on challenging those thoughts over and over and over again to figure out how to help you rewire them and change them.
And so you may be living with an anxiety disorder for a long time and think, but this is just me. This is just the way life is, when in fact, you could be a much better version of you if you didn't have this backpack on your back of all this anxiety. And so if you're thinking, oh, maybe this is an issue, it's really worth tapping in for an evaluation to see how severe this is and how much better you could feel.